welcome you all to the first webinar of Mindful Mundus Mental Health Project. And the first webinar is on managing anxiety, stress, and productivity. I am Sunika Joshi. So I usually introduce myself as a mental health professional or practitioner, and I'm also a trainer in mental health. Before I worked in mental health setting, I worked with children and families living with HIV/AIDS. Also worked in refugee education, women empowerment, gender-based violence, human trafficking, and also in the NHS in the UK. So I've also co-founded a project and a social enterprise called DAFE after the huge earthquake in Nepal. I'm also from Nepal. So this project is basically a women empowerment program for the livelihoods of disadvantaged women who were affected by earthquake back in 2015. So apart from that, I've also volunteered in youth-led organizations like Road Track Club, and I've also led as president. And I've founded projects, education projects, and also environment-related projects while I was leading in the voluntary organization. I've also traveled across the United States, as well as a few countries in Europe, living with host families, sharing cultural values and norms, and also volunteering in different communities like refugee homes, refugee camps, and also in homeless shelters. I've also worked at UN Women as an intern, particularly for 16 days of activism, and also worked and researched on survivors of violence, such as domestic violence and intimate partner violence. And yes, towards the end, I have received awards like Erasmus Mundus and also Chevening. So what we are going to do today is that first we are going to talk about a little bit about mental health, then we go into stress, and then we talk about anxiety, intrusive thoughts, time management, burnout, work-life balance, and then towards the end, mindfulness and resilience. So the informations are very short because it's 1 hour and we have a lot of topics, but I've tried to include more information and more activities and also room for discussions in our workshops. So please don't be disheartened if I did not give you a lot of information on these, but I assure you that there is more in the workshop. So the aim of this overall theme is to be aware of mental health issues that arise due to stress, anxiety, life changes and challenges, and also to emphasize the importance of self-care and mental well-being. And I also encourage open conversations about mental health among us in our days and days to come. First topic, mental health continuum. So in the past, we have referred to mental health as a binary concept. So we either said whether you have mental health issues or you don't have mental health conditions. But what we have to realize is that human minds are always changing and always moving. So this mental health continuum gives us an idea that mental health can be in a continuum and have a linear relationship. So depending on our internal and external factors, we can be at any point of these state in mental health state. So as situation improves or as situation deteriorates, like we are moving throughout in this continuum. So it implies that we are all capable of moving along this continuum, as well as it doesn't mean that once you're in at one point, for example, if you're in crisis, it doesn't mean that you cannot be in a thriving state after you have sorted out your issues or after you have worked on what issues that you have been through. And one of the common factors of this is stress. So stress determines stress, that is life events and different other aspects that we experience stress, determines where we are at. So we can be in thriving state, or sometimes with that stress that we are experiencing, we can be in struggling state, surviving state. But being in one end doesn't mean that you will just get stuck there. And one of the most likely outcome of all mental health conditions is that there is recovery. So people who experience mental health conditions, they do not get stuck to that condition lifelong, most of it. There is a recovery process for it, all the mental health conditions as well. So we have talked about stress as a common factor where it affects our mental well-being. So let's go to another topic of stress. So stress, I think we, whenever we say I'm stressed, like we are referring to all the negative aspects, like we are relating to the tensions, the pain, the emotional turmoil that we are going through. But we can divide stress into two. One is eustress and another is distress. So for distress, we can also call this chronic stress. And for eustress, we can also call this a short-term and acute stress. So for distress, it is the negative stress or the bad stress. And it usually causes unpleasant effects like worry, panic, hopelessness, anxiety. And this distress being the examples are like financial difficulties, or you've been bullied, or different other aspects. And for eustress, it is positive stress. So positive stress that motivates you to take action. It increases your excitement and improves your performance. So we say that some amount of eustress or moderate amount of stress is needed for us to function in day-to-day life. For example, if you have a huge presentation and you're going abroad, you're going to an international organization taking that presentation, you might feel very stressed about it, but that is eustress. That is a stress that is challenging you, and after you've overcome that situation, it is very rewarding. It also, like during that process, it provides you that motivation and that excitement, and also improves your performance. What we have to be careful about is the distress, because this stress, when we feel that stress for a long period of time, it causes a lot of emotional, physical health issues and mental health issues as well. So if you recognize these signs and symptoms early on, you can also work on these so that your symptoms and your stress does not lead and affect your mental well-being and your physical health in the long term as well. So how to recognize your signs and symptoms of stress? So you can always do your self-assessment to recognize stress, and you do it in the 4 aspects. One is physical. So you are experiencing exhaustion. A lot of times there is fatigue without any reason. You're feeling tired all the time. There is headache, an unexplained headache where you just get like random pain around your body, and also like worsening pre-existing health conditions or mental health conditions. For example, if you have some other health conditions before, then it might make it worse. And there's also like it makes your breath really like fast, and it also affects your gut system as well. So you have to recognize these physical symptoms. And then there are like emotional symptoms where there is like feeling of sadness, despair, anxiety, and there's anger, and you're irritable a lot of times. And in mental assessment, you look for like your forgetfulness, how difficult it is becoming for you to concentrate, or like you're also finding it very challenging to make decisions. And in terms of behavior, this is most visible aspect as well, not only in yourself, but also in your friends and your loved ones. So when you stop acting like yourself, you feel like, you know, this is not me, like you feel very different than your usual self. And you're experiencing restlessness, and you're becoming very negative and very reactive, that is like very argumentative. and you're experiencing changes in eating, sleeping, and also you start relying on substances or alcohol to deal with the stress. So long-term stress, it also can cause anxiety. So the next topic. So anxiety itself we say anxiety is the problem, but anxiety is simply a response to stress or threats or any future concerns or worries. And anxiety shows up in physiological and psychological signs. Similar to stress, you see physiological signs like rapid heartbeat, shortness of breath, dizziness, being very nauseous, uh, and also feeling like you're going to collapse sometimes. And in psychological aspects, you see that your thoughts are like you're very worried all the time. But we all feel anxious. We all have this response in different time of our life, but we have to separate when it's just anxiety and when it's anxiety disorder, right? So anxiety is a reaction to stress or difficult, challenging situation, and it has a starting and ending point. For example, like when the stressful situation is over, the signs of anxiety also, it lessens. And it can be managed with like breathing techniques and relaxations as well. You must have seen like before competitions, like people just take very long breaths and they're like just preparing to go on the stage and perform. Right. Whereas an anxiety disorder, it is a constant worry causing like significant distress in your life. And it doesn't, it lasts for like weeks or months. And there's no like you feel like you cannot control your emotional response. Sometimes it's very heightened, sometimes it's like very low, and it interferes with your daily life. So anxiety disorder, like it just makes you avoid a lot of things, and you're very worried about things that's going to happen. You feel threatened, you feel like you're in danger. So it is irrational fear. You start avoiding like places or situations. And when you're in anxiety disorder, you also feel like it is impossible to manage these symptoms. As I said in the beginning, that there are symptoms that shows in physiology, our body, our thoughts, and our behavior. So I talked about the symptoms that our body shows in form of like being very like sweaty, you start feeling cold sometimes, and then you feel like you can't breathe well, you feel very tired all the time, and you have gut issues like stomach issues as well. And in terms of your thoughts, you go into very negative and unhelpful thinking. Like you must have heard about catastrophizing. So you think the worst case scenario of all the bad things that might happen. So your thoughts go in that direction, and you have trouble concentrating, and you're worried about future. You're thinking, what if this happens or that happens, and it's usually negative. And in behavior, it's mostly the most common thing that you see with anxiety is withdrawal. So you're not withdrawing from people and work and schools. You're withdrawing from the symptoms of anxiety. So wherever you felt anxious and wherever you felt triggered, you prefer to avoid those places and people as well. So withdrawal is a very common sign of anxiety as well. And also like you start losing interest in your activities and your hobbies that you used to do before. Okay. So when we diagnose anxiety disorder clinically, so we look for these kind of symptoms, and it can be these symptoms can be like can persist for even 6 months or more. Okay, and we ask people who come with anxiety issues, we ask if you have felt trouble relaxing, if you have persistent and excessive worry that is interfering with your daily life, and if you are always nervous or always on edge, and you're easily annoyed or irritable. So these are the most common signs of anxiety. And when we're assessing, we look for these signs as well. And there are like few risk factors that increase the risk of getting anxiety disorder. And that is like when you have had like history of mental health conditions, like you already have some other mental health conditions, and then there's likely that you also have anxiety disorder. Usually, like if you have depression, sometimes you also have anxiety disorder later as well. And then difficult childhood experiences, dealing with uncertainty and changes, like people during COVID, a lot of people experienced anxiety because they just did not know what's going to happen in the world. They felt quite uncertain about things that might happen. So people were feeling very anxious about it. And if you have experience of physical, emotional abuse and also neglect while you're growing up or even now, chronic stress, isolation, loss of loved ones as well, and physical health issues also has a high risk of getting anxiety disorder. And some examples are hypothyroidism, like those kind of physical health issues also have symptoms of anxiety. What is most important to understand in anxiety in yourself as well as your loved ones who's experiencing anxiety is that we feel that anxiety tells us that you're in danger. Okay, there is a threat that is going to harm you. And that is the message that when you're anxious, you get it. And there are like very uncomfortable symptoms, such as like you're worried, you're very fearful, and you're feeling very overwhelmed. And you also have physiological symptoms like racing heart, and you're sweating. And when you are triggered, when you feel anxious in certain situation, when you're outside or maybe when you're in school, you try and avoid it. The next step is that you try to avoid these uncomfortable symptoms. So you start skipping classes, you start procrastinating, and you start using like drugs or alcohol to avoid these symptoms. And it does give you a very temporary relief. It gives you like a temporary, you feel like, okay, my anxiety has lessened, but it is short term and it is temporary. But what this avoidance does is that it makes our life very small. It shrinks our social circle. It shrinks our ability to go out, and we also like start cutting off opportunities and also meeting people. So we feel like, okay, we're trying to avoid feeling anxious. But then if it is not sorted, if it is not treated, then it in the long term, in the long run, this anxiety becomes like much more bigger, and then it goes in the same cycle again. So in therapy, we try and understand what are they avoiding, what are the things that they have been doing to avoid anxiety, and that's where like we start working as well. So when you're feeling anxious, when you're avoiding things, like try to understand, are you avoiding the feeling of being anxious? Are you feeling like there is some kind of danger, some kind of threat? And we will be talking about how to manage these symptoms and how to manage anxiety in our workshop as well. But for now, I just want to tell you that there are like two ways that we usually deal with anxiety. First is coping methods, and that we do it with breathing techniques, with using mindfulness, learning skills such as time management, also like grounding and activating our five senses. So these are something that we talk about in therapy a lot. And there is therapeutic interventions such as cognitive behavioral therapy, talk therapy, and there's also a process where you process anxiety. You sit with that anxiety and look at it like, why do you feel threatened by certain things? Why do you feel anxious when you're in certain places? And there's also a therapy called exposure therapy for people who develop that anxiety of going out, or like even taking a flight or using a public vehicle. So we're in the next topic. And before we go in, I just want to do a small group activity where I ask you all to think about anything in the world, anything, but do not think about pink flying elephant. And I just don't want you to think about the pink flying elephant at all. Right? So I wish I could see your faces and see like what kind of pink flying elephant do you imagine? Like I think we are 100 people here. Sorry, I'm sorry if you do not hear me, but I asked like you can think about anything in the world, but don't think about the pink flying elephant. Okay, so I'm just wondering, how did that pink flying elephant look like to you? So we go to our next topic, which is intrusive thoughts. So this is what intrusive thoughts are about. That the more you try and control those thoughts and more you try to push it away, more it comes back. And it becomes very powerful when it comes back. So what is intrusive thoughts? So intrusive thoughts is a strange, disturbing thought or troubling image that pops up in your mind. And these thoughts are often very unsettling, and it may bring on feelings of worry or like shame. And you might feel like you're such a bad person to have these kind of intrusive thoughts as well. And these intrusive thoughts are such loud, and it kind of demands your attention that it feels like, you know, it's true. However, like these intrusive thoughts are very far from reality. And these thoughts, it might be violent, or it might be sexual, or recurring fear that you will do something inappropriate or embarrassing. And it can range from like random images to disturbing and violent ideas like punching someone in the face or hurting yourself. And as I said, the more you try to push the thought from your mind, the more it persists. Right? And there are different kinds of intrusive thoughts. I'm sorry, this is not the slide. So there are different kinds of intrusive thoughts. And I'm just going to run you down like through some of the most common ones. And intrusive thoughts can be thoughts of self-harm. Okay, you feel like, what if I kill myself? Or what if I jump through the building? Or what if I crash my car? And this is not a thought that comes out because you want to hurt yourself. It is just an intrusive thought. Like you can imagine these intrusive thoughts like a bubble, just pops up and then it just goes away after a while. And this is one. And there's also thoughts of harming others. And I've seen this in new parents, new mothers, especially where they say, I am so scared that I will hurt my baby. And when they're in therapy, like we ask, would you really hurt your baby? Like if there's a baby right here, like would you? And then they think, okay, that was my intrusive thought. That's not my intention. That is not what I want to do, but it's just an intrusive thought. And it can also be in terms of like sexual intrusive thought, where like people might think like, am I attracted to a child? Am I a pedophile? Or also like questioning your sexual identity as well. Or like imagining someone doing the sexual activity or things like that. And it can also be related to your spiritual and religious thought, where you're continuously concerned if you've committed a sin, if you've heard your religious spiritual leaders thought, or if you've done something wrong that is against your religion, against your spiritual beliefs. And it can also be where you self-doubt and feel like, you know, I'm not even good enough for this job. Or it can also be, do I really love my partner? Like after like 5 years of marriage, or even like 2 years of marriage, this intrusive thought might just come up and say, did I really love this person? These are like intrusive thoughts. And it can also be related to health, where you feel like you have very dangerous disease or you have germs everywhere. These kind of thoughts come to people. And the more you try to suppress it, the more it comes out stronger. But intrusive thoughts are also symptoms in people who have mental health conditions like obsessive compulsive disorder, postpartum depression, anxiety disorder, also post-traumatic stress disorder as well. But in these symptoms, the thoughts are very extensive. It's very regular and it's disturbing their life to an extent where they can't function well, where they feel like, they will act on it, or they feel the compulsion to do something to take that thought away. And it's usually an OCD. So there are certain myths of intrusive thought. So having intrusive thoughts mean that you want to act on these thoughts unconsciously. So it's quite the opposite. You're actually trying to fight these thoughts, and you have a continuous fear that you will act on it. And these thoughts are usually against your values and beliefs. So it's not that you will act on it. Okay. Myth number 2 is all thoughts that come to your mind should be analyzed and examined. So as I said, these thoughts are like bubbles, and these thoughts that come up involuntarily, first of all, and they do not reflect anything about your personality or your unconscious or subconscious beliefs. Okay, so you don't have to examine these thoughts because it does not carry any sign or meaning or desire. And having intrusive thought means that you're a bad person. So, as I said, everyone has intrusive thoughts. There has been a lot of research and studies where they've shown that people who seem very calm, people who seem very educated, people who have been in the most professional achievement, all of these people have intrusive thoughts. Okay, and these do not reflect your character or your desire to do anything. Okay, and sorry, it was supposed to be myth 4, but there's a typo. So another one is only person with mental disorders have intrusive thoughts. And as I said, there are some mental health conditions that have these intrusive thoughts more often and in more intense form, but it's not just people who have mental health conditions. It's everyone, every human beings have these intrusive thoughts. How do you deal with these intrusive thoughts? So one thing is when that comes up, when that pops in your mind, you just label and identify the thoughts as intrusive thought. Just say, if you feel like just harming yourself or just pushing someone or punching someone, you'll be like, oh, that is an intrusive thought. And recognize these thoughts as involuntary. You did not want that. You did not choose that thought. It is automatic and it is irrelevant to your inner desires or what you want. And accept their presence and allow them in your mind rather than pushing them away. So just accept that you are having that intrusive thought. Okay, just let it be there and allow your mind to experience that and say, okay, this is my intrusive thought, rather than saying why am I thinking this way and feeling guilty about it and feeling like you're such a bad person to have these thoughts. And expect that these thoughts might come back again. But remember to pause and give yourself some time, and do not rush into acting on it or telling people that something is wrong with me or things like that. Just give yourself time and see how these thoughts will just go away on its own without any pressure or without any force. And make sure that you continue with your daily life rather than feeding these thoughts, because our brain, what we say in our mental health is if you consider yourself as a bad person, your brain will try and give you all the evidence supporting it. That's how our brain works. So that is why, like, you don't have to feed these thoughts and say, okay, am I having these thoughts because I committed a sin, or am I having this because that is who I am underneath? And like just continue with your daily activities, and try and just accept as these thoughts come in. So we go to our next topic, which is time management. I think we are still on time, just checking if we are on time before we go into the time management. So time management is a skill. So it's a skill that helps in maintaining work-life balance, and it helps in increasing your productivity in your academics and your work, and also supports in decreasing the burnout. So what are the things that is involved in time management? So when you're doing time management, when you're learning these skills, you're also learning effective planning, your project planning, your travel plan, what you want to do in your career, to what you want to do this week. So you become very effective in planning. You also become very good in setting priorities. You understand what is the priority for this week, what should you focus on, and what should you put, what areas are not important right now. Okay, and you're also managing stress. So stress management comes under time management as well. So by managing time, you are lessening the stress that might come with last minute submissions, especially in Erasmus, like projects. So you're managing stress as well. And another is proper task delegation. So under time management, you understand that you cannot do everything on your own. And when you try and do everything by yourself and keep adding responsibilities or taking responsibilities and not being able to say no, then you feel very overwhelmed, and that's when like your time management goes all over the place. So in time management, you also need to understand that if you can delegate some tasks to your friends, especially in your group work, how do you delegate these tasks in the group? Who is doing what? If there is a group of 5, how do you make sure that everyone is doing 20% of the project, right? And also it's about smart goal setting, specific, measurable, achievable, relevant, and timely goal setting. So you're being very realistic with your goal and not making it over the board, something that is not achievable. And also at the same time, you learn to avoid distractions. First, you recognize what is distracting you, what is taking a lot of time that is not being productive in your life, and avoiding such distractions. And we are going to learn about a lot of tools on time management, and that's going to happen in our workshops. So burnout, I think like if you are in Erasmus, if you've worked before, especially at work, you felt like, okay, maybe it's a state where I go into burnout. So it's a state of physical, emotional, mental exhaustion. It's not just physical exhaustion, it is like physical, mental, and emotional exhaustion. And it is caused by excessive stress at work or even your academics. And it's not just limited to people who are working. Even caregivers can experience burnout. Even parents can experience burnout. And burnout has negative effects on your overall well-being. It also affects your performance and your quality of life. Right? So what are the common factors that contribute to burnout of Erasmus students? So first, it can be heavy academic workload. But along with these, we also experience issues such as you're moving away from your home, maybe you're feeling isolated because you've left your friends back home and you have to create a whole new circle of friends, and you have to adjust to a new place, and there will be so many cross-cultural challenges that you would face moving from one country to another. And sometimes being in a very competitive environment, maybe inside a classroom, can also make you feel like a burnout. And a lot of issues that I understand people face is also about grades, because maybe in your home country the grading system was completely different, but as you move to different universities, the grading is very different than what you're used to, and then maybe you're receiving low grades and you just don't understand why it is happening. And then you feel like, okay, like I've done my best, but still like it's not happening. So there is a high chance of you to feel burnout from that issues as well. And visa issues, like I personally experienced a lot of visa issues coming from developing countries as well. And this is like on top of your workloads that you have to do, on top of like finding a new place to move into different universities, to managing your finances, you have that visa issue that you have no control over, and you just have to rely on the embassies to get it. So these are factors that contribute to burnout, especially when you're in Erasmus program. And apart from these, there's also lack of recognition. For example, you put a lot of effort in your work or in your internship if you're doing it, but it goes unnoticed. No one recognizes your input, your work, and then you feel like, you know, like there's no use of me putting so much effort. And when there is poor communication in the team, where the roles and responsibilities are not clear, and you don't know like where you're at, what is going to happen next, and there's no proper communication channel, then that contributes to burnout as well. Poor leadership, where there is lack of management, where everyone is just struggling to find things to do, and there's no proper setting, there's no proper structure in the organization, then that affects your performance as well. And now there is no downtime after stressful workload. For example, it is very common for you to have deadlines in organizations or even in your Erasmus programs, and you spend a lot of time working on those workload, and that's a mission. And after that, you do not take any break and you immediately go into another project. So if you don't have that downtime, then you also feel burnout. And there is unfair treatment and discrimination issues that you might face at any organizations or institutions based on your race, your disability, your ethnicity, your gender. So when you're discriminated, when you feel like you are the minority, where you're not being heard, then that's also one of the factors that contribute to burnout. The earlier you recognize the signs of burnout, it's better like you, as soon as you recognize that, you go for some kind of intervention, you look for support, you communicate that you are going through burnout. And these are the signs that you have to recognize. And most of the time, the symptoms are that you get very irritable, you have very heightened emotional response. Sometimes you're just crying for no reason, like out of nowhere, you just feel like crying. And that is also like symptoms of burnout. And you can also go into a very negative attitude, like cynicism, where you start hating the job, you stop feeling the purpose, like you just feel like, why did I just do this in the first place? You know, you kind of have like negative attitude towards your job and also to the people you're working with. And and a lot of times, like people also rely on substance abuse to deal with burnout. And this is when like people really struggle to come out of that burnout stage, because substance abuse really affects their ability to come out of that burnout stage, and it makes them feel more tired and exhausted as well. And there's decreased performance, you have sleep disturbances, you have gastrointestinal problems, you're feeling exhausted all the time, you have like headaches and pain in your body. So when you recognize these signs that is coming out of nowhere, or you feel like your emotions are becoming more negative than usual, then you have to ask yourself, is it because I'm reaching the stage of burnout? And you don't have to consider like, is it the start of the burnout or the peak? Like even at the start, it might be very detrimental to your mental and physical well-being. So these are the signs that you have to recognize. And obviously we are going to work more on this in our workshops as well. So comes another topic, which is work-life balance. And in case of Erasmus, you would say like academic and life balance. So the concept of work-life balance is that you maintain an equilibrium between individuals' academic and their personal life. And personal life does not mean just their families and their relationship, but also their self-care, their personal well-being, and how much time they're spending in meaningful activities as well. So work-life balance is kind of like divided into how well are you performing at work? It can be your academics, and how much support are you getting from work to maintain that work-life balance? What kind of facilities are there? What kind of resources are there? And in terms of your life, how well are you still connecting with people? Because that is the basic human need. And how well are you taking care of yourself? How much are you engaging in your activities, in your hobbies that is making you feel satisfied as well? So importance of work-life balance, it is to maintain your quality of relationships. So spending time doing things together, it fosters relationships and connections. So you have to prevent burnout, and to maintain your physical and emotional well-being, you need work-life balance. So engaging in activities outside of work, and it gives you a sense of fulfillment. You're engaging in your hobbies. You're not giving up on your personal interests out of work. Right? And this also helps in sustaining a career over a long time when you have work-life balance. And comes the next stage, which is mindfulness. So with the topic of mindfulness, we work in this concept, the idea of mindfulness, in our therapies almost like regularly. But what we've found is that, what I found is that people prefer mindfulness as meditation. And I want to move beyond that idea and introduce that mindfulness is not just meditation. Okay, so it is the two basic idea of mindfulness is awareness of breath and present moment awareness. And this can be integrated in your way of life. So what it simply means is that it is non-judgmental acceptance of one's thoughts and feelings. And with this, you can engage more authentically and empathetically with others. And you have healthier relationships with your thoughts and emotions. And you also learn the skills to respond rather than react to challenging situations. Okay, so how do we do this? Is mindfulness that big thing? Like people feel very overwhelmed when we talk about mindfulness. But mindfulness can be done simply while you're walking, while you're even like drinking or eating, or when you're doing your art or you're doing your journaling. And it involves like deep breathing as well. For example, the mindful walking, for example, you take a walk out in the nature. You're just simply walking. But then if you just pause for a moment, then first you start hearing the birds. You start hearing the very loud birds and the birds who are like a bit quieter. And then you start hearing the leaves and the trees just shaking gently with the wind and with the air. And then after that, you kind of feel that air on your body, on your face, and you see like there is so much greenery around you. So that is what mindfulness brings us to. It is about just being aware of where you are, what you're doing, and what's happening. And it is simply just accepting that state without judging that, without trying to change any of it. So it can be done in your daily activities. And to people who say, well, I really don't have time to slow down at any point of time and just do mindfulness, then I suggest them you shower, you brush your teeth, you eat every single day. So this is what you can do when you're showering. And this is where you can integrate mindfulness. And people say that you are not going to leave the concept of mindfulness at all. But I personally like taken in mindfulness as my way of living as well. And I see how much things have changed for me, how much I've become patient, how calm I've become, especially like when I was starting this presentation, like I was thinking like I do need to do some breath work, and I just did 5 minutes of like breathing before I started this. And I'm much more calm than 1 hour before I started. So, like even when you're showering, you can just activate your senses by listening to the water, just feeling it like where the water is hitting on your body. You see how the water is moving down and going down in the drain. You just try and smell the soap that you're using, the shampoos that you're using, and you can just do some breathing exercises while you're showering, or while you're eating, or while you're brushing your teeth, and if you drive, even while driving. So it's a very simple concept, but this helps in stress management. It helps in managing your anxiety, and it helps in a lot of other aspects of your well-being. Resilience. So resilience is also a skill that can help you effectively manage stress and navigate challenges in a healthy and adaptive way. So it is just you standing through the storm. Okay, just imagine yourself sailing through the storm. Quite dangerous though. But it is just the ability of individuals to withstand, adapt, and recover from adversity, challenges, or difficult life events. And it is also the ability to manage and regulate your emotions effectively. You gather more flexibility in your thinking. And resilience is very much related to finding a sense of purpose and meaning in your life. And when you work with that purpose and meaning in your life, you have stronger resilience to get through all the life challenges. And resilience also depends on your network of supportive resilience, supportive relationships that foster resilience. So when you have these two, then you see how much resilient you become. And we will be talking about what kind of skills and characteristics are needed to gain resilience. And this is something that can be learned. Okay, so resilience skills that helps to prosper in Erasmus programs. I've divided it into physical resilience, mental resilience, emotional, and social. So physical resilience is preparing your body, your physical health, to deal with any challenges, any physical demands, or maybe like any kind of illness or any kind of injuries. For example, you're moving from one place to another, and there's a high chance that you might fall sick. There might be some injuries as you're moving, or you might have some physical health issues that develops out of stress or out of like just being in a new place as well, or changing in the weather, different aspects. So this is where you need to develop physical resilience, and that is through healthy life choices. You make sure that you don't go to bed without proper dinner, or you're eating healthy and nutritious food at all times, and you're not just sacrificing on your physical health. So you have to prepare yourself to be physically healthy to face any kind of challenges. And mental resilience is the ability to deal with uncertainty and challenges, and you have a very effective and healthy coping strategies to deal with any kind of challenges. And you're responding to situations and these challenges rather than reacting and being negative. And in emotional resilience, it is about being able to regulate your emotions, being aware of what's happening with you. Okay, not just not validating your emotions that is coming out of the stress and challenges. You accept that you are feeling anxious, you are feeling stressed about it, but then you maintain that hope and that optimism that this challenging situation is temporary and it won't last forever. And social resilience, when you're in Erasmus program, is the most needed and most important part, because it involves community, social, and support group. And it is about working together as a community, as support groups to solve any problems. And God forbid, like I hope there is not another, but for example, if there is any natural disaster in the country that are in, for example, like in one of the countries that I was interning, like there was earthquake. And that's where you need that social resilience, which is community resilience. You come together and try to understand that it is a collective problem, and you come together and solve it. You support one another within that group, and you maintain that support. You try and see who needs more support, who needs additional attention, and build that resilience and coming together to build a sense of community. So these are some of the resilience that you need during the Erasmus program, as well as after you've left and you're continuing with your daily life. So this, I want to end this session before I take a question and answers about, I just want you to take this question with you and ask, when you face adversity and difficult life situation, how would you bounce back stronger, wiser, and more able? So I just want you to take this question with you tonight. And we'll discuss more about this in the workshops. So I'm taking in.
Yeah, wonderful presentation from you. Thank you so much, Sunika.
Yeah,
there are
so
actually
let's
some
just
questions.
say, yeah, sure, that you're not alone if you're facing any mental health challenges. I'm always happy to help you, and we have created this community.